Hello everybody. This video is specifically for fall 2021, so I review some of the topics, important topics for NP1. I have a little bit common cold in the last few days, so I don't know, my voice may not be very good, so apologies in advance. So first thing to know is the classification of epithelial tissue. One is, as you guys know, it's called the squamous. So there's two types: simple, which means one layer, flat. The locations: mesothelium, which is the body cavities; endothelium, which is the blood vessels; kidneys, lungs, and cornea. Stratified, which is multiple layers: mouth, esophagus, rectum, and vagina. So in any area that there's a lot of physical friction, you can see stratified squamous. Cuboidal, first is simple, which is one layer. The most common type of simple cuboidal is glands. Some ducts of some glands also have simple cuboidal, and you see part of the kidney that has simple cuboidal epithelium. Stratified cuboidal is not common. You only see it in some of the ducts. Columnar, there are three different types. Simple one, which you see it in the digestive system, like stomach, intestine, and gallbladder. You see it in the fallopian tube and kidneys. So kidneys have different types of epithelial tissue. You can see that. Pseudostratified, the most important area that you see is in the airways, so trachea and bronchi. You also see it in the nose and part of the male reproductive system. Most important is airways. Stratified columnar, not a lot, so you don't see it everywhere. An area that you can see is in the throat. Also ducts, this is most commonly seen in the ducts, and also in male urethra. Only a part of the male urethra you can see a stratified columnar. The last type of epithelia is transitional. You see it in the urinary tract, okay, not in the kidneys, in the urinary tract. Connective tissue, so there is three different types of connective tissue. One is the connective tissue proper, which you have the loose connective tissue and dense connective tissue. And loose is like loose areolar, reticular, and adipose tissue, and dense is dense regular, dense irregular, and dense elastic. Fluid connective tissue, you have it in blood, and interstitial fluid, which is between the cells, and lymph, which is in the lymphatic vessels. And finally, the solid ones is called supportive connective tissue, and you see it in the cartilage and the bones. Muscles, there's three different types of muscle. One is the skeletal muscle. This is the one that is under your conscious control. They are striated. So these lines that you see is striated. They are all parallel to each other, and they are multinuclei. So each fiber has a lot of nuclei. Cardiac is also striated, but is branched. Is branched like this. It's not parallel to each other, it's branched. It has intercalated disc. This is intercalated disc. Most of them have one nuclei. Some of them may have more than one nucleus. And the smooth muscle, which is not under voluntary control, similar to the cardiac muscle, is non-striated. So there's no lines here. You can see there's no lines here. It's spindle shape. Like this one, like a fish. It's uninucleated, so the nucleus is in the middle. And also it has a dense bodies, so dense bodies that attaching one smooth muscle cell to another smooth muscle cell. For the skin, you have to know the layers of the skin. So the most superficial layer is the epidermis, and epidermis is made of stratified squamous epithelium. Epidermis again made of 4 or 5 layers. Then is dermis, which is the thick layer, and that is made of papillary layer, which is superficial, and that is made of loose areolar connective tissue. And the deeper layer is called reticular layer, and that's about 80%, and that is made of dense irregular connective tissue. A hypodermis is not part of the skin but studied together with the skin, and that is made of adipose tissue and some elastic tissue, and it's very vascular. You can see a lot of blood vessels here. The bone structure, so there are different types of bones, 6 different classification of bones, but the easy way to divide or classify the structures, you can divide it into long bones and flat bones because these are the 2 common types of bones. The long bones, if you look at this image, it has 3 different parts. One is the ends, the proximal and distal ends, and that is called epiphysis. In the middle, this area, the long area, that is the shaft or the aphysis. In the shaft, you can see an area, there's a cavity there, and that is the medullary cavity. And in between the epiphysis and the aphysis, there's an area here that you don't see it in this bone, but it's usually when you're growing, it has cartilage, and that is called metaphysis. So this is an area that a person grows, that the bone elongates. Long bones are again divided into 2 different types of tissue. One is called compact, the other one is spongy. So compact is this hard tissue, so surrounding the medullary cavity. Also you see the thin layer of the compact bones around this area. So it is, compact bone is in the superficial area of bone. And spongy, which is the soft, and you can see it in the epiphysis in this area. And the flat bone does not have medullary cavity. The superficial area is made of a compact bone, and in the middle is made of the spongy bones. The spongy bones is also trabeculae. So here is the larger image of the trabeculae. And you can see that it is made of concentric lamellae. It's covered by endosteum, and these are the canaliculi, opening of the canaliculi. There is no central canal, so that's the difference between the trabeculae and the osteon. Osteon is in the compact bone and has central canal, and this one does not have central canal. Central canal contains blood vessels and nerve. So what is inside, what is in between these trabeculae, which looks like branches of trees going regularly all over, like a network of bone tissue. In between you have bone marrow. So normally when you're younger, you have the red bone marrow, which makes blood. As you get older, it replaces with fat, so that's why it looks yellowish, and that's why it's called yellow bone marrow. So there is 4 different types of cells in the bone. So one is called osteogenic or osteoprogenitor cells, and these are located in the periosteum or in the endosteum. So they are making new cells, so they are stem cells. The new cells are called osteoblasts, and the osteoblasts are making the bone matrix. So the bone matrix, the organic bone matrix, which is made of different proteins, like collagen fibers, and also it will be later calcified. Osteocytes, these are the mature cells. These are osteocytes. So once the bone matrix is calcified, these osteoblasts are trapped, and then they become osteocyte, and they are maintaining the bone tissue. And these are the canaliculi, which are important for nutrition, removing waste product, receiving oxygen. And finally, you have the osteoclasts, which are really big cells. They're multinuclei and release acids and enzyme and destroys the bone when the calcium level is low. these cells become active under the parathyroid hormone and then release calcium from bone and increase blood calcium. Some review of the axial skeleton. So you can classify the skull into the cranial bone, facial bone, and associated bones. So cranial bones is the frontal bone, parietal bone, occipital bone. You have the two temporal bones on each side, and you have one sphenoid bone and one ethmoid bone. Facial bone is the nasal bone, lacrimal bone, zygomatic bone, femur. You have the maxilla or upper jaw, and mandible, which is the lower jaw. And the associated bone, which is the hyoid bone, is in the neck, and you have the auditory ossicles, and there's three of auditory ossicles, and they are located inside the temporal bone. Another topic is the sinuses. So you have 4 different sinuses. You have the frontal sinuses. You have the ethmoid sinuses, which is in this area, in the superior and middle nasal conchae. You have the sphenoid sinus, which is this one, so below the sella turcica. And you have the maxillary sinus, which is around this area behind the inferior nasal concha, so it's around this area. And by the way, this is the lateral wall of the nasal cavity. This is the roof, and this is the anterior wall, and this is the floor of the nasal cavity, which is also makes the roof of the mouth. Some of the bones in the appendicular, one is the scapula, so it's a triangular bone. It has 3 borders, superior, medial, and lateral. It has 3 angles, the superior, lateral, and inferior. The lateral one is really important because glenoid cavity is located here, and the glenoid cavity is the one that articulates with the head of humerus. It also has 2 processes. The anterior one is called coracoid, and the posterior one is called acromion. So this is the coracoid, and this is acromion. This is the anterior view. In the anterior view, you have only one fossa. It's called the subscapular fossa. And in the posterior view, you have 2 fossae, supraspinous fossa and infraspinous fossa. They are separated from each other by the spine, and you can see the spine moves laterally, ends up with acromion. For the bone of the arm, which is humerus, so you can see the head of the humerus. This articulates with the glenoid cavity. You have 2 necks. One is anatomical neck, which is the epiphyseal growth plate, and the other one is the surgical neck. This is the area that humerus can break with trauma. You have the 2 tubercles and bony prominence, greater tubercle, which is located laterally, and lesser tubercle, which is located anteriorly. This is greater tubercle from posterior view. And in between you have the intertubercular sulcus. In the shaft area, you see the deltoid tuberosity and the radial groove. Some bones in the hands. So you have 3 parts. You have the carpal bones, you have the metacarpal bones, and you have the phalanges. So there are 8 carpal bones, 4 of them in the proximal row and 4 of them are in the distal row. So lateral to medial, so you see the thumb is located laterally. This is the radius located laterally in the anatomical position. So scaphoid, lunate, triquetrum, and pisiform. This is in the proximal row, and then there's the trapezium, trapezoid, capitate, and hamate in the distal row. You have 5 metacarpals here, and you have the 14 phalanges. So the hip, you can see that partially it is the axial skeleton, which is the sacrum and coccyx, and the rest is the 3 bones of appendicular system that are fused together. And here the sacrum articulates with the ilium that makes the sacroiliac joint. The thing that you can see superiorly, you see the ilium, and ilium has the 2 spines here, anterior superior and anterior inferior. There are also 2 of them located posteriorly, but you don't see it from this view. Then you have the pubic bone, which is located anteriorly and inferiorly, and ischium or ischium, which is located inferiorly and a little bit posteriorly. You have the acetabulum, which is made of all 3 bones, and acetabulum is located laterally, and acetabulum articulates with the head of femur. Iliac fossa is located medially, and here you have the pelvic brim, which is also the internal ring when the baby is passing through the birth canal. So this is the area, the pelvic inlet. The 2 pubic bones fuse together with a cartilage here, and that is the pubic symphysis here. Under that you have the pubic arch. And also the obturator foramens are made of these 2 bones, the pubis and ischium. So femur, proximally you can see you have the head. It articulates with acetabulum, and then it's in a narrower area. This is the neck, which is highly possible during osteoporosis to break. So very common. Clinically, you see that the break happens here. And then you have the 2 trochanterids, greater trochanter located laterally, and lesser trochanter located medially. You also have 2 areas that are connecting these trochanters. So intertrochanteric line is located anteriorly, connecting the 2 trochanters, and intertrochanteric crest is located posteriorly. In the distally, you have the 2 condyles here, medial and lateral condyles. In the posterior view, you have the intercondylar fossa. Above that, you have the popliteal surface, and anteriorly, which I don't have an image in this PowerPoint, that is the patellar surface anteriorly. Patellar surface. Bones of the foot. So again, similar to the hand, there's 3 different areas. You have the tarsals, you have the metatarsals and phalanges. There are 7 tarsal bones. So this is the talus. Talus is located superiorly, and that articulates with tibia and fibula, the 2 bones in the leg. So the fibula is located laterally and tibia is located medially. Inferior to talus, you have the calcaneus, this is the heel. Anterior to talus, you have the navicular bone. Anterior to navicular bone, you have the 3 cuneiform bones. And lateral to the cuneiform and anterior to calcaneus, you have the cuboid. Then you have the 5 metatarsals, and you have the 14 phalanges. This is the classification of joints. So this is the functional classification and structural classification. Based on the movement, you have synarthrosis, means there is no movement, amphiarthrosis, some movements, diarthrosis, there is a lot of movements. But again, each one is divided in subcategories based on histological features. So synarthrosis divided into 3 different parts. One is called fibrous, the other one is cartilaginous, the third one is bony. Fibrous, there's 2 types. One is called suture, which you can see then between the skull bones, and gymphosis, which you see it, the connection between teeth and jaw bones, so mandible and maxilla. Synarthrosis, this is the one that connects epiphysis and diaphysis, so you see that in the epiphyseal growth plate. And Synuses, there is bones that fuse together like a mandible and the frontal bone, and initially they are two separate bones and then they fuse together. Amphiarthrosis, so some movements are there. One is called fibrous. The fibrous one is made of dense regular connective tissue, and that is called syndesmosis. And examples of syndesmosis, one is between the bones in the forearm, so between radius and ulna, and also bones in the legs between tibia and fibula. Cartilaginous, that's called symphysis, that is fibrocartilage, and that is located in the pubic symphysis and also in the vertebral column. You don't have a bony type of amphiarthrosis. Then is the diarthrosis, which is highly mobile, and they are called synovial joints because there is two different bones, and each bone is covered by a hyaline cartilage, and they are wrapped by a capsule, and inside the capsule you have the synovial fluid, and then you have different ligaments that are supporting the joint, and you have some other features like fatty pad for support, and some joints also have menisci, like knee has menisci. Menisci are made of fibrocartilage, but the bone that the end of each bone, the epiphyseal area of each synovial joint is covered by hyaline cartilage. So a good example of the synovial joints are the limbs, upper limbs and lower limb joints. It's easy to remember it that way. Important joints, one is the shoulder joint, so that's called glenohumeral joint also. The ligaments, look at the connection between the bones. So this is the coracoid, this is acromion, so that is coracoacromial ligament. This is the coracoid, this is the humerus, so coracohumeral ligament. And this one is called transverse humeral, and that is supporting the biceps tendon. And you also have between the coracoid and clavicle, so this is the coracoclavicular ligament, and between acromion and clavicle, so that is acromioclavicular ligament. So you can see here, this is the glenoid cavity of a scapula, and this is the head of the humerus, and this is the synovial cavity that contains synovial fluid, and this is the capsule, and this area is the synovial membrane that makes the synovial fluid. Also the joints also have different bursae. Bursae contains synovial fluid to reduce friction. A hip or coxal joint is another example. So there's 4 different ligaments there, and this is the connection between the head of humerus and the head of femur and acetabulum. So the 4 different ligaments. This is the anterior view, so you can see iliofemoral from ilium to the femur. This is the pubofemoral from pubis to femur, and this is ischium, so ischiofemoral ligament. So these are the external extracapsular ligaments, and then you have one intracapsular that you see, and this is the ligamentum teres, or ligament of femoral head. You also have the acetabular cartilage, and you have the acetabular labrum, which is just an extra cartilage for support. So For muscle physiology, one is the component of a sarcomere. So sarcomere is a repeated unit of muscle, skeletal muscle and cardiac muscle, and here is an area between the two Z lines or Z discs. So you see the thick filaments, which is in a bluish purple kind of color, and the thin filament, which is in the red color. An area that you can see only the thick filament, that is the H-band in the middle. The thick filaments are connected to each other, and it's called the M line. And this is an area that you see thick and thin filaments together, and that's called the zone of overlap. And this area that you see the zone of overlap with the H-band together, that is called the A-band. Zone of overlap with H-band together, zone of overlap, an area that you see only the thin filaments, that is called the I-band. So the different parts of the thin filament, one is the F-actin strand, which is made of the G-actin molecules, and they are connected together with the nibulin protein. So this is a nibulin protein, and the G-actin molecules are connected and twisted, making a strand. Then is the nibulin, which I just mentioned it, and the tropomyosin. This is a protein that is covering the active side of actin, and then is the troponin that when the calcium attaches to troponin, it moves tropomyosin to the side, and then the active side of actin is exposed, and that will cause myosin to come and attaches to the active site of actin. So thin filament is not just the actin, okay? So these four proteins. The thick filaments, so one is the myosin. This is the myosin that has a tail and a hinge and a myosin head, and multiple myosins together. That makes the thick filament. They are connected with each other in the midline, and that is the M line or M protein, and then they are connected with this protein like a spring that goes all the way to the Z disc, and that's called titin. Classification of different types of contraction. One is called isotonic. So iso means equal or same, and tonic is related to the tone of the muscle. Here you have the same tone, but the length may be different. So one is concentric, it means the length of the muscle decrease, and the other one is eccentric, which means the length of the muscle increase. So here the body can overcome, or the muscle can overcome the weight, and here the muscle cannot overcome the weight, and this is why it lengthens. Both of them are isotonic. And isometric means the length of the muscle stays the same, but the tone of the muscle changes. For example, this is for resistance training, for example, pushing against a wall, or doing push-ups and things like that. So that changes the tone of the muscle. You can push more or less. Some of the anatomy of the skeletal muscle. So important area is the shoulder joints. So some muscles are responsible for flexion, which is the anterior movement of the arm. So deltoid, okay. Deltoid has three different functions. So one is the flexion, the other one is abduction, and the third one is extension. Pectoralis major, okay, and the coracobrachialis. Three different muscles. Shoulder extension, so again the deltoid is there. Then this is the posterior view, so you see the teres major and latissimus dorsi. So when it's flexion, think of the anterior and lateral view of the shoulder. When it's extension, think of the posterior and lateral view of the shoulder. shoulder adduction, so moving the arm toward your body or midline. So you have the 4 different muscles, 2 of them anterior, 2 of them posterior. So pectoralis major and coracobrachialis, so they are anteriorly located. And then you have the teres major and the latissimus dorsi, which are located posteriorly. And shoulder abduction, so moving the arm away from midline. And again, this is the deltoid and the supraspinatus muscle. This is supraspinatus is located posteriorly. So this is the supraspinous fossa of scapula. Hip is also important. Here you see some different movements. So one is the hip extension. So gluteus maximus is responsible for that. This is a cut of gluteus maximus. This is another view. And hamstring muscles. So hamstring muscles are located in posterior part of the thigh. So this is the biceps femoris, semitendinosus and semimembranosus. Hip flexion. So you see iliacus and psoas major. So both of them are together. That's called iliopsoas muscle. This is one muscle, and then is the quadriceps muscle, which is the rectus femoris, and the 3 vastus muscles. So vastus medialis, vastus lateralis, and vastus intermedius, which is behind the rectus femoris muscle. Hip adduction. So for hip adduction, so moving the your lower extremity toward the midline, you have the gracilis, the most medial muscle in the thigh. You have the adductor magnus all the way, adductor longus, adductor brevis, pectineus. And for lateral rotation, you have the gluteus maximus, you have the piriformis, you have the superior and inferior gemellus, you have the obturatus internus, okay, which is the same as this one also, obturatus externus, and quadratus femoris. And that's it. So I hope you liked the video.